Lose your facial fat to look younger. There, I said it. And all this time you were trying to save your facial fat to look younger. Were you wrong, or have I just lost it? Well, I saw 4 patients in my clinic this week. They were getting RF microneedling. A couple at a different clinic and a couple were my patients. And they were terrified of losing their facial fat because they might look older. The same thing with people dissolving fillers. They're worried about losing your facial fat. What did I tell these people? You want to lose your facial fat if you want to look younger. Now, what am I talking about today? We're going to get into that. The first thing I want you to look at is these 3 pictures. Tell me how these 3 people are aging. Let's look at picture number 1. Let's look at picture number 2. And let's look at picture number 3. Now, do you see a commonality here? This is why you see Madonna get such a tight jawline after her surgery. Yes, facial fat descends. So if you look at these pictures, they're all showing how facial fat is moving to the lower face. The fat pads are shifting. Some of them are hypertrophying or growing. Some of them are shrinking, and some fall down due to many different reasons that we talk about on this channel. But imagine getting rid of the fat down in your lower face to look younger. That's what I'm going to help you do today and help solve some of the difficulties in your mind of the procedures you may want to get, or even the things you want to do at home to look younger, maintain your facial fat where you want it, and keep the fat in your upper face, as well as avoid the number 1 mistake people make when they lose their facial fat. Thicken your skin and stay looking youthful. Now, I did just have this done, and I took a picture just this morning so you can see the downtime. This is 6 days after I had RF microneedling. 10 days before this, I had a chemical peel. So you see some dry, flaking skin, and then you see the areas of little bruising underneath here that you can see where the microneedling went in. Now, you know I went deep. Now, of course, I treated my neck and jawline. I did not treat my face. When we go into my clinic, I'm going to show you, and this will make exact sense why I didn't treat my face. I'm happy with my facial fat. Overall, I don't want to get rid of facial fat there, and I don't feel like I need skin tightening. There's other things I can do, eat, drink, and topicals that make my skin tight, but down here, I needed that little bit of help. So you give an idea there, and we will go into my clinic. I'll make much more sense of this when I show you exactly what not to do, because there is one thing that you could do that will age you within a week or 2 of doing this, and you can look 5 or 10 years older if you make that mistake. Now, if you're using a derma roller, a microneedling device, because can you lose fat from derma rolling? Well, almost never. What about microneedling? The pen that goes straight up and down with the needles? Almost never. So it's a question I get asked all the time. If I get microneedling with no energy, because we talk about microneedling as one, but understand derma roller and the pen that goes straight up and down do not have energy in them. However, it's what you use as a slip that makes the difference. So imagine if you're putting in a fat dissolver or something causing inflammation with the derma roller or with the microneedling pen, that will cause facial fat loss and thinning of the skin. And so many of you are using a slip that is not sterile, that's pro-inflammatory, or you're doing those procedures too much. But in general, they will not get rid of fat if you keep those factors in mind. Now, let's go to the energy device. And I interviewed Dr. Ben Talay from Beverly Hills, one of the top facial plastic surgeons in Beverly Hills. We were talking about nasolabial folds. Listen to what he had to say about the mid-facial fat pad we call the deep medial fat pad. Listen to this.
This is Dr. Ben Talay out here in Beverly Hills talking about nasolabial folds. So the nasolabial fold is a junction between your cheek and your upper lip that tends to form on people over time with either a little descent of the face or deflation. It is not I'll tell you what it is not. It is not a fold that occurs like a belly fold. So it's not a belly fold that's there that needs to be like liposuctioned or taken down or removed or anything like that. Why it happens is because you end up with a concavity in a certain area that comes and folds around and forms a shadow. This could happen from mid-face collapse in terms of volume loss. It could occur because of descent, and it can also occur because of volume loss within the nasolabial fold itself or below. And the only way to know is to feel it. So you can feel it and see if there's good volumetric support underneath, and that'll help determine what to do. If you add volumetric support, meaning fat grafting to it above it, it's going to give tremendous change in shadowing, contour, and improve it on the majority of people. This may not cut it on everybody, so sometimes you need to do radiofrequency treatments. Radiofrequency treatments, you have the ones that try to melt fat. I don't advise doing those. The ones that tighten the skin overall are a better move, and they treat it more appropriately.
So you see from that, it's shifting of the fat pad as much as anything. So you see what Dr. Tali is saying. It's about the artistic use of supporting the facial fat pad above the fold. And then if you want, you can use skin tightening with RF to tighten the skin to get a bit of lift, but not dissolve the nasolabial fat pads. The fat pads are all different around the face. However, we might want to dissolve, I use that word loosely, the fat of the lower face. So it's all about the consult. It's all about dissolving fat in some places, tightening and lifting, but it's the artistic use of all the different tools we have, from fillers, skin tighteners, biostimulators, and of course, skincare. How does this apply to you? Well, imagine if you could shrink the fat where you didn't want it and maintain the fat where you did. That's exactly the point of this. Now, before we talk about the 3 factors that you want to consider before getting any type of microneedling, let's go into my clinic so you understand microneedling, you understand what this device does and why everyone's terrified of it. Check this out. So here is an RF microneedling device that I use. Now check this out. I'm going to press the button. Do you see those needles come out? Let's get that in focus. Now watch this. I'm going to press the button. It's going to be, this is 3.5 millimeters. You see that? I'm going to turn this down now to, let's go down to, so you can see 1 millimeter. See if you can see this. Sorry, we'll get that in focus. There we go. Watch this. You see that? You see the difference? There's 1 millimeter. Again, I'm going to go up to 3.5. Now imagine, see that? That's 3.5. Imagine using this setting on your forehead where there's almost no fat. So if you have someone that's not thinking about this device, here's the trigger, then they're going to use that on your forehead. Now let's go down to another situation here. You can see depth is also important. Now if we look here at some settings, we zoom in that if I can for you. If I look at some settings, this is absolutely key. I can go up in levels and increase the amount of heat. This is set at 1 second duration of the heat. And I'm going to go down to what you might use in a forehead. You do not want it that much. You want it very low. Let's just go to 100 for our time. And what you're going to hear, let's go on to, and I'm going to click it. And what this is going to show you is how quick it is. Boom, boom. So you can tell now we have a very quick burst of heat. That you wouldn't want a long heat duration anywhere you don't want to get rid of fat, like a forehead. And then, so you have those 3 parameters. You are going to have the depth of the needles. Again, see how deep that is, how quick that is. Now watch, I'm going to go to shallow. You don't even really see the needles, right? Okay, that would be a forehead. But again, imagine I had a forehead and the duration, you can hear how long that click is. Imagine if I had the duration this long on a forehead. Even though it's shallow, you hear that. So it's so key, the settings, the level of the heat, the amount of time that the heat gets in there, and of course, the depth of the needles. And so all those play a big role. So if you want to get rid of fat, you want the long duration, a high heat, doesn't have to be too high, but on the higher side, and this kind of a depth. I'm going to show you here. Okay, that is going to get rid of a lot of fat. Look how deep that is. And on this device, only the tip of those needles are heating. So I wanted to go through that with you because you need to see exactly why and how your provider is actually thinking. If they're not thinking and they don't change this one setting here, which is the depth, they don't change the duration, then that means face fat loss where you don't want it, and that is a disaster. So now you see the importance of three things. Number one, the device. The device has to be good. Typically, these devices cost a clinic about $150,000, but they're predictable energy delivery. Number two, the person performing your procedure needs to think. What do I mean? Well, your jowl is likely different than mine. Your cheek and under eye is likely different than mine. In fact, your skin color is likely different than mine. Because of those things, we have to consider possibilities of pigment changes, what we call post-inflammatory hyperpigmentation, seen mostly in darker skin. Lighter skin, totally different settings. We can hammer the skin, we can be a little more aggressive. And it depends on the history of the patient. Keloid scarring, meaning if you form those big scars when you get a cut or an injury, those are all things that the person doing your treatment needs to think of. And of course, assessing your face with movement and at rest to make sure they're giving you the best results. But it's not a set it and forget it procedure. Who does your procedure matters. The third factor is, how do you maintain the fat where you want it to be? As you heard in the video with Dr. Tali, you want to maintain the medial cheek fat pad. So you're not going to try and dissolve something like your nasolabial fat pad. You want to reposition it. What does that mean minimally invasively? That means getting the fat pads in the midface, in the back of the jawline, healthy. We do that with what? Things like PRF, platelet-rich fibrin, biostimulators like Sculptra, and the best skincare that you can afford. Prevention here is also key. So sunscreen so you don't kill the fat that you already have. And most importantly, do not allow inflammation on your face. A lot of the UV damage we get, the pollutants, a lot of the extraneous factors from our diet, poor eating, they reflect in our skin because inflammation kills not only your dermal thickness, which causes lines and wrinkles, but the fat pads and, of course, hormones. So exercise is important. And if you're female over the age of 35 or 45, you want to consider getting your hormones tested and looking for signs of hormone imbalance. One of them, unfortunately, is thinning of the skin. Hormones play a key role. You can see then how microneedling is absolutely an important procedure, but it is crucial who does your procedure and what the device is and how they think of your face. One of the most important things you're ever going to get from your provider is a great facial consult. If you get a great facial consult, you're half the way to rejuvenating your face safely and effectively. There's two things you should think about doing now. One is go to my store locator if you're looking to find a great provider, store.rajanimd.com/locate, and go to quizmd.com. When you get there in under 5 minutes, you're going to get a skincare plan that I would recommend for my patients in my clinic for someone with your skin type. You're now going to want to watch this video on how you can reverse skin thinning to keep your skin and body beautiful, healthy, and vibrant.